Hi, welcome to Nutritional Medicine by Lab Analysis. My name is Dr. Cyrus Thomas. I've been licensed as a chiropractic physician for some 34 years. I also am a diplomat of the National Board of Homeopathic Examiners, and I have a medical doctor of homeopathy from India. I'm very excited to talk to you tonight about nutrition. Tonight's show is about cholesterol. It's a topic that many people are confused about, and I'd like to tell you about the wonders of what diet and nutrition can do to correct these blood values. So later in the program, we'll talk about how we do a blood analysis and a hair analysis and compare those results to those of many other people. Cholesterol, treat it, not the symptoms. So we're not trying to just lower the amount of bad cholesterols in the blood. We're actually trying to treat the entire problem of cholesterol from its very core. This is a little joke. That's a little wooden stool inside of the bottle there. It's called a stool sample. Cholesterol, a lot of words here, but it does many things. Number one, cholesterol is the most slipperiest substance known to man. That's why it's in the blood as the oil for the blood. When the blood gets down to the capillary level, the capillary is about as wide as a red blood cell. So for that red blood cell to squeeze through there, it needs to be a slippery area. If we get the cholesterol too low, that won't happen properly. Total body cholesterol is, synthesis is about 1 gram per day. That means we make about 1 gram of cholesterol per day. That's not very much. And the total body content is 35 grams. So we're only making about 1/35 of what's in us every day. And then, of course, our intake of dietary cholesterol is about only 0.2 to 0.3 of a gram. That's less than we're actually making per day. The body compensates for cholesterol intake by reducing the amount synthesized. So if we take in a lot of cholesterol, we'll make less cholesterol. It's required to build and maintain membranes. All cells are surrounded by a membrane. Much of that membrane is actually built of cholesterol. And cholesterol itself actually resides within the membrane and can change what's called the membrane fluidity. It changes how easily or how difficultly materials can go in and out of the cell through the membrane. Intestinal absorption of fat molecules as well as fat-soluble vitamins A, D, E, and K. So we need cholesterol to also be able to handle our fat-soluble vitamins. And it's also a precursor in the synthesis of vitamin D and the steroid hormones. So to get our female and male hormones developed, produced, we actually need cholesterol for those, including the adrenal gland hormones as well as cortisol and aldosterone, sex hormones, progesterone, estrogen, and testosterone. And it's also thought that cholesterol might also work as an antioxidant. So first I want you to see how many good things cholesterol can be. Let's look at the next slide. It's a very slippery substance, and it's necessary that we should be concerned with ways in which to control it and not to eliminate it. What should you eat to have your cholesterols in balance? We have very low density lipoproteins, low densities, and high density lipoproteins. Everybody's concerned. They think that if they eat fat or they eat cholesterol, they'll have too much fat and they'll have too much cholesterol. If you eat the proper fats, that's not true. If you eat the wrong fats, that is true. If you have a lot of carbohydrates, you're much more likely to have problems with your cholesterol than if you actually make mistakes with fats. Making mistakes with carbohydrates is crucial. A lot of people are continuing their mistakes with carbohydrates, and then they take pharmaceutical medicines to control the cholesterol. That's not the way to go about it. Food, dietary advice. Without doubt, nicotine, stress, and alcohol and dietary mismanagement must be considered contributory factors. Although the body is capable of making its own cholesterol, it is nevertheless dependent on the cholesterol obtained from food. So, for example, we like to obtain cholesterol from eggs. So, they're a good source of cholesterol. Egg yolk also contains lecithin, which actually helps to work with the cholesterol. This was a patient who was a male weighing 230 pounds, 30 years old. He's presenting symptoms. He had eczema, chronic fatigue, allergies, skin problems on the feet, elbows and legs. His skin problems developed 6 years ago. Patient works as a machinist with a lot of solvents, specifically naphthol. Chronic fatigue syndrome, eczema in the feet, elbows, and legs, which developed at 6 years of age. Allergies presented in 1996. This patient was a walking heart attack with a coronary risk of 11.5. He had a total cholesterol divided by high-density lipoprotein, the good cholesterol, and an of 11.8, and he had an HDL of 17. His blood was like sludge, and he didn't even know it. Within 2 months on the program, nutritional program, his coronary risk had gone from 11.8 to 6.9 and continues to improve. He now has energy, he can sleep, and digestion has improved, skin has cleared up. He's lost 25 pounds without even exercising. Attitude and mental abilities have improved. He's had no flu or colds. This is a nice story. Now let's talk about the 3 different types of cholesterols. The very low density lipoproteins, lipoproteins means fat protein molecule. The very low density ones are made in the intestines and the liver to carry fats to the body. They carry mostly triglycerides. We need these VLDLs. LDLs, low density lipoproteins, is a primary carrier of cholesterol in the blood to the organs and cells. Why? So that it can make cell membranes, and so that it can be the precursor for the production of all those hormones that we talked about a moment ago. HDL is the high-density lipoprotein, is the most protective form of lipoprotein. Now, chylomicrons carry triglycerides, that is fat, from the intestines to the liver, to skeletal muscles, and to fat muscles. See this big thing here? This is a chylomicron. And they depending on the size of them, as we see here, the diameter in nanometers, this is whether they're HDL, LDL, IDL, which is intermediate, or very low density lipoproteins. Chylomicron, when we take these and surround them with the bigger molecule, the whole chylomicron is 100 to 1,000 nanometers in diameter. We'll look at a close-up of that. You can see the C's are the cholesterol, and the T's are the triglycerides. These colored molecules are called apoproteins. There's a B and a C and an A. And there's these phospholipid molecules that are in between. Now, if you recognize this molecule, it is 1/2 of the membrane of a cell. Normally, you would take 2 of these and put them this way, and they intermingle this way. The reason why we surround the cholesterol and triglycerides into this chylomicron shape is because the cholesterol and triglycerides are not water soluble, and they will float in the blood. That will cause problems. So to get them around from one place to another, every time we have to move them either through the blood or through the tissue that's between the cells, which is watery-like, or to move them in the cells from one organelle in the cell to another organelle in the cell through a liquid-based material, we have to have it in the chylomicron lipoprotein shape because they float. In my office, we do standard examinations, and we're checking for blood pressure. We check the ears, the eyes, nose, the throat. We're asking people about their general health condition. We're looking at blood pressure. We're listening to the heart for murmurs and for arrhythmias. We also look at x-rays, as you can see, and had a lot of x-ray study in a chiropractic medical school. One of the most difficult things for us to tackle when we are talking to a person about their lipid profile on their blood test is that they need to get it straight in their heads that the eating of good fats, such as coconut oil, coconut butter, actual animal milk butter, olive oil, the butters that are the oils that are in cheeses and dairy products, those and in meats, those are saturated fats. Those are your good fats. They're also the monounsaturated fats, which are the good ones. The polyunsaturated fats are the bad fats. Those are the ones that contribute to atherosclerosis and cancer. Not all of that is believed today in medicine, but it is certainly believed in all of nutritional practices. And that includes all physicians who practice nutrition know what I'm saying. This is the blood analysis. So we do 52 elements in the blood. The previous results are on the right column. The present results are on the left. We can see that a lot of the colors have changed here. Yellow is a warning, red is high risk, and blue is sort of clinically critical, as in a code blue. Let's look at a close-up of that. When this patient went on the nutritional program 5 months later, many of their reds had turned to either yellow or back to white, which is perfectly normal. This blue had gone to yellow, blue to red. Some whites remained white because they were already good, and this red went to yellow and a red went to white. So this person did very well on the program. We're looking at a much more stringent range of normal. We want people to be in here. This is where healthy people are. When your values are here or here, you're told that everything is fine because you're between the dotted lines, but in reality, you still don't feel well and you don't know why, and you think it's still a mystery because everybody tells you that everything's okay. There's absolutely no risk in this testing, blood and hair, unlike exploratory surgery or doing a needle biopsy, which could spread things, or testing by prescribing. Oftentimes, a person is given a pharmaceutical prescription to see how it will work. That's called testing by prescribing. And I don't think it's a great idea because of side effects. The hair follicle has an artery and a vein going into it, so it picks up what's in the blood and puts it into the hair shaft. So when we test the hair shaft for different substances, we can find out really what's in the blood. Let's take a look at this sample of a hair analysis. The top half are the heavy metals, and you want the heavy metals to be at 0. This person, you can see the black lines are creeping into the yellow and the red. The bottom half of the test are the good metals and the minerals. And we want those to be neither too low nor too high. So we want them in the mid-range. And so we've done a test. We see that some are low, some are high. The hair contains minerals and essential elements like copper, chromium, iodine, sulfur, and iron, 22 essential elements. The hair test tests for 17 heavy metals like arsenic, lead, mercury, tin, and aluminum, ones we don't want, and a blood test alone will miss all of this completely. So almost everybody in the United States who is receiving only blood tests is missing all this information. The key points about this kind of testing are that we're doing many more tests of the blood than usual. We do 52, and that includes cancer markers like 19, 9, 125, CEA, etc. A healthy range is created. We look at that more narrow range. And 3, the lab results are compared to those of many other people. And 4, we do follow-up studies, and we list the follow-up information side by side with the previous information. If you were to design a better system, could you? I actually think this is a fabulous way of doing medicine these days, and I believe that in 30 to 50 years, most practitioners will be doing it this way. The results speak for themselves, however, so changes have to be made in the patient. You can visit my website and read the case examples that are there at www.alternativeинtegrativemedicines.info. You can also see your ailment there. This is an example of the actual report that we produce from the blood and the hair test. Patient's name. We're looking at their presenting symptoms. We give you a questionnaire. We collect a lot of those. We also are looking at primary findings, medications that you're on, and possible side effects. We interpret all of the test results, looking at a blood lab and coronary risk assessment, possible cardiac effect for this patient. They might be pre-diabetic. There's inflammation. There's anemia, possible infection. We talk about all of the blood values, and then we go to hair values. This person had chromium, high arsenic, high hair cadmium. They had a high lead as well as mercury. So we talk about the hair values in detail and where you can pick up these metals. We also look at diet and exercise considerations for the person. It's a 15-page report. Strengthening training, water consumption, and then of course you get a copy of your own blood test, and this person had a blood test and a follow-up. And here's the second page. This person had many follow-ups over a 2-year period. They actually did 5 blood tests. And we're looking at the hair analysis here of before and after of the heavy metals and the good metals and minerals. It also comes up with a list of nutritional recommendations that we go over together and determine what would be best for you. It's like going into a health food store and you see 2,000 products there and you're wondering what you should take. You go, oh my God, how am I going to do this? This test tells you the 6 or 10 that would be the very best for you to actually correct what we know is imbalanced in the blood and hair. Some things in the news. There are drugs which relieve depression by increasing serotonin levels may backfire by providing bacteria with tryptophan. When you relieve depression by increasing serotonin, you increase tryptophan. That actually can feed some bacteria. So that's something to be leery about with the serotonin enhancing psychotropics that are being used today. Humans infected with Toxoplasma gondii, that's a protozoa. It's kind of like part bacteria, part plant. They're 6 times more likely to be in traffic accidents. Interestingly, they saw this, they injected it into rats, and the rats infected lose their fear of cats and are more likely to be eaten. So we have to wonder, are people who are driving losing their fear because they have Toxoplasma gondii? We need to look at the person's health on a microbial level as well as nutritional. Is aging more a question of natural degeneration of the human body or an increasing debilitation from chronic infections? So we have fungi, we have bacteria, we have viruses, we have protozoa, we have parasites. All of these things can take us down. So if our nutrition gets bad enough, these creatures, these microorganisms can take advantage of us. They are opportunists. And then together with the bad nutrition, the ill health, and the opportunistic infections that are taking place in us, our aging is bound to be sped up. So it's probably a combination, and also that's going to affect genes and their telomeres, which will speed things up as well. So aging turns out to be a rather complicated thing. I need to apologize for what I said last week. I said that there was a portion of the brain, I mentioned the substantia nigra, which I was talking about with Alzheimer's, and it is uniquely connected to Parkinson's. My mistake. What is a nutraceutical? It is an extract of foods with a medicinal effect on human health. The nutraceutical is usually contained in a medicinal format such as a capsule, a tablet, or powder in a prescribed dose. More rigorously speaking, nutraceutical implies that the extract of food is demonstrated to have a physiological benefit or provide protection against a chronic disease. This show is for people who suspect that maybe the answer lies in nutraceuticals. Who should watch this program? And it's also for people who want to not feel stuck with feeling toxic and who want to avoid surgeries. They suspect that nutrition doesn't just mean shopping in a health food store, that at its deeper level, when utilized as a medicinal science, has much to offer them. This program will show you a safe way to take nutrients to cure chronic ailments. This safe way is based on blood tests, like I talked about earlier. And the doctor has a way to follow up to know the effectiveness of the nutritional medicines by retesting and comparing the new results to the previous results. We're also comparing those results to thousands of other patients who have been run through this same system, and we also know how well their improvement did under certain nutrients. So we're also comparing how well the nutrients are doing. This is truly state of the art. Let's take a quick look at the system of medicine. There are structural techniques like chiropractic, massage, body techniques, physical therapy, and exercise. There are energetic healing techniques like homeopathic, psychic healings, religious, magnets, electrical. There are moleculars, that's what we focus on here, food, nutraceuticals, herbology, drugs. And then, of course, there's talk therapy, psychology, lectures, television, movies, conversations, self-help classes. All of these can be medicinal in their own way. Let's focus on the molecular. Food, nutraceuticals, herbs, and drugs. These are all chemicals. They all go into the mouth, into the intestines, and then to the blood, and then into the cells. They all go into the cells and affect the chemistry there the same way all medicines do. Nutraceuticals are medicines. They are naturally occurring medicines. They are non-patentable and remain at low cost, whereas drugs are patentable and are usually at much higher cost. They're naturally occurring, meaning they make up for what is missing in our food. They supply what the body would normally require, and they make the body work the way it did before it became ill. A key point. Drugs are man-made molecules different than what are found in foods or healthy bodies. They treat the symptoms. Smart medicine is nutritional medicine. And nutritional medicine, of course, comes in two parts. There's dietary, which we make dietary changes and better choices even when we go out to restaurants. And then there is supplementation, and those are the pills that we take orally. We also do oral chelation to get rid of those heavy metals. When we talk to a patient, we go over the 15-page report together. We talk about the findings that were done in the physical exam. We discuss nutrients, which can be done in detoxification, nutrification, and also we can address all of the microbial issues that we talked about before, the parasites, the fungi, the bacteria, and the viruses. So nutrition, supplemental nutrition can be done in a variety of ways. The last 30 years have shown an explosion in nutritional knowledge. Nutraceuticals are medicines. They are complex molecules. The only difference is that they are not found in nature, is that they are found in nature, and so they cannot be patented for profit. These are some of the nutrients we have in our office. I just wanted you to be able to see these. You know what it's like when you go into a health food store and you're looking at thousands and thousands of these. It's hard to decide what to take. So you ask somebody, have you got anything for headaches? Have you got anything for diarrhea or whatever? But nutrition should really be done in a much more comprehensive way. We know you have headaches and diarrhea, but you've been eating this way for years and you had these diseases in the past. It should be a very comprehensive, holistic view. Enzymes are really important too. They help a molecule change its shape or help it add on or remove other parts. So to go from molecule A to molecule B, you can see these two molecules join this gray enzyme. And they connect up. The enzyme makes them change color, as you see in this example, and then they're able to leave. They're actually different molecules, and it was the enzyme that did that. Sometimes the enzyme that is where this arrow is a vitamin catalyst. Sometimes it's a mineral catalyst. Sometimes it's amino acid catalyst. But in all cases, they're acting like an enzyme. No one needs to be told to stop any drugs or treatments. Don't stop your medications just because you make dietary changes or buy some nutrients. Pharmaceuticals give support, but once nutraceuticals begin to affect a cure, then follow-up blood and hair tests will show that it is wise to reduce them. Diet plays a large role in nutrition, and we take all of this into consideration. A chemically balanced person can handle most stress physically and emotionally. So some people will say, well, I eat really well, I'm just having a lot of stress these days. Well, you shouldn't be reacting so strongly to the stress if in fact you were eating really well. We also have to be concerned that people can have, that most trends are asymptomatic. That means that as we're getting sick, we don't realize it. There are no symptoms. And then we should also realize that there is a masking of symptoms, which means that as we get used to constant symptoms, we sort of just think they're normal. And in fact, they're really not normal at all. These are some of the homeopathic remedies that we have in the office. We actually have about 15 drawers like this. We're running a little short on time, so I wanted to cover this. Changes to nutritional prescriptions. What we thrive on is a diet where the weight of our food should be 30% fats, 40% carbs, and 30% proteins. This is easy to prove in an abundant number of university studies. Max Planck said that scientific theories don't change because old scientists change their minds. They change because old scientists die. There's a code of honor that all doctors should ascribe by. They have to do their best. They have to be honest. They have to tell you exactly what they really think. Because without health, how can one fulfill their optimum potential and purpose in life? This is my website, integrativealternativemedicines.info, office on D Street here in San Rafael. I'd like to thank the crew. They're doing a great job tonight. And special thanks to the Community Media Center of Marin for allowing this show to be. This show airs every Tuesday night at 8 o'clock and sometimes during the week. But if you go to my website, you can also see all the older shows that are there. I want to thank you for watching this program, and I wish that you remain in good health.